name is Sam, and I'm a current PhD student at Boston University specializing in schizophrenia. Schizophrenia is what we classify as a severe mental illness. About 1% of the population are diagnosed with schizophrenia. It's a very underrecognized, stigmatized mental illness. So it's more common in men, schizophrenia, but men oftentimes have a later onset of schizophrenia. And like I said, the later onset, the more severe it is. So men tend to have more severe cases of schizophrenia because they're more likely to be diagnosed later on in life. But the average age of onset is about mid to late 20s. Some of the common symptoms of schizophrenia include hallucinations, delusions, paranoia, but there's also a lot of symptoms that people don't recognize, what we call negative symptoms. Negative symptoms mean, an easy way to remember negative symptoms is something that's decreased from what's normal. So people with schizophrenia often have a lack of motivation, they have a lack of facial expressions, a lack of affect in their face, and a lack of speech as well. And this is what we call the negative symptoms. And the positive symptoms are what's added on to what's normal. So the hallucinations, the delusions are what's added on to normal reality. I guess the main thing to do is to just, if you're recognizing, a common symptom would be paranoia is often recognized. So if somebody is recognizing, maybe somebody is experiencing paranoia, I would definitely just try to see a psychiatrist or a psychologist as soon as possible, because the longer these symptoms go on, the harder it is to treat. So you really want to step in right away when you experience these symptoms. Paranoia is, say you're riding the bus and you see somebody sitting next to you and you think that they're out to get you, they're out to hurt you, when you have no basis in that for reality. So it's really just being afraid and thinking things are going to happen to you when they're not really going to happen to you. The main treatment for schizophrenia is antipsychotic medication. This medication treats what I said earlier, the positive symptoms of schizophrenia, but the negative symptoms of schizophrenia, the lack of motivation, the lack of affect in the face, they're not really affected by antipsychotic medication. So people are trying to really understand the negative symptoms and how to treat them. There's a lot of psychosocial interventions. There's a lot of social skills training that help with these. But there are recent pharmacological leaps for negative symptoms as well. My guidance would be to just give their unwavering support to the person. It's really important that that happens to families a lot, is their own family starts to stigmatize them, and that can lead to even worse outcomes. So it's really important for the families to be supportive, whoever it may be, and to get them help as soon as possible. My PhD, I'm currently working on my dissertation study, which is looking at the role of motivation and pain sensitivity in schizophrenia. So for that study, I'm trying to look to see if a patient's motivational levels can help explain their low levels of pain sensitivity. So we still have a lot of work to go, but we have made great strides in people recognizing mental illness as a real thing.